Hi, it's Ms. Sujita Koirala. Today I have chosen our topic of the homelessness boy whose name is Paul, and I'm going to give a presentation on the topic empathy and the existence of empathy gap in the healthcare. And also I'll be discussing being a registered nurse in the future, how the empathic care can be given to the patient like the vulnerable group like Paul. And also I'll be discussing about some of the communication technique that can be delivered in the patient care. So let's start with empathy. So what is empathy? Empathy is a nurse's ability to understand someone else feeling an emotion, and moreover putting oneself in the other's shoes and see the world from their perspective. So just we can give the empathy care to the patient by just knowing their need and preference and acting accordingly, help them to alleviate their pain and suffering. Also, numerous studies have shown that there is a positive relationship between empathic care and the nursing health outcomes. So being a nurse in our everyday lives, we come across the people with different cultural, social and economic background. So there is the existence of empathic gap due to the nurse unable to understand the patient perspective and unable to view from their perspective. So they are unable to provide the empathic care. And also I would like to say that we being as a complex human being, we quickly judge and hear, we quickly judge what we hear and see. Because of this we judge this because of this our unconscious mind behavior, we are unable to providing the empathic care in the nursing. So now let's talk about the background of the Paul. So Paul is a young teenager. So he used to live with his parents, and but his relation is always being unhealthy with his parents. Because of his behavior, he always used to put in trouble by himself. So at the age of 16, he revealed that he was in relationship with girlfriend and that she is pregnant. After knowing this, his parents totally rejected him, and they were not very supportive to him. After being rejected by his parents and because of this disrupted family relationship, that leads him towards to become a homelessness. So after realizing the Paul's situation, of course my feeling was not positive towards him. The way we are labeling and judging him as a homelessness, yeah, from our conscious or unconscious mind. And the nurses, we are holding the stereotype that um, stereotype for the certain group of people prevent us to provide the empathic care to in the nursing. But however, we nurses are bound by some of the professional code of conduct, and being as a nurse, we should not bias any patient by looking their status and background. So thus we can provide empathic care. Mm, Empathic care, thus we can provide the empathic care. Providing empathic care and person-centered approach can help to uh, bridge the empathic gap that is existing in the healthcare. Now, moreover, I'll be discussing about the communication technique that can be used in the pulse care. So there is some. I would like to talk about the verbal communication. The verbal communication is understanding the patient complex need, and it can be delivered in written and oral form, like nurses clarity of speech, active listening, and using empathic language and vocabulary that can be helpful in the communication. Likewise, for Paul, active listening is listening to his story, and without going to the conclusion, first listen to him, and that is the good care for him. Also, I would like to say, using empathic language, like is that happened to you, this word can be empathic in the for him. So likewise, non-verbal communication is the nurse's attitude and behavior, that is the body language of the nurses. So that can be the facial expression, warm toss, nodding, and good eye contact. So because of, if we practice those kind of in their care, then the patient will feel that they are being valued and they are being respected. So now in conclusion, I would like to say nurses should challenge their own stereotype and prejudice to give the more empathic care. And also empathic care is very important in the nursing to build the positive relationship, and communication considered very important for the healthy relationship between nurse and patient in the healthcare sector. Thank you.